Hi everyone, welcome to Psychology with Sarah. My name is Sarah Gupta and today we are talking about Generalized Anxiety Disorder or GAD, which is a type of anxiety disorder characterized by excessive, uncontrollable worry about everyday situations. This video is part of a series where I'll be covering different psychological disorders in detail, including their symptoms, causes, DSM criteria, everything. If you haven't watched my previous video where I gave an overview of anxiety disorders, make sure to check that out first. Now, let's get started. सबसे पहले let's talk about what is generalized anxiety disorder. So, generalized anxiety disorder or GAD is a mental health condition that causes fear, worry, and constant feeling of being overwhelmed. So, it is characterized by excessive, frequent, and unrealistic worry about everyday things like job responsibilities, health, chores, and it affects children and adults. So, GAD is one of the several anxiety disorders, and most people with GAD have one or more psychiatric conditions like major depression, specific phobia, social anxiety disorder, panic disorder, etc. Who does GAD affect? So, generalized anxiety disorder can affect both children and adults, and this condition often begins in childhood or adolescence, but it may begin at any age. And actually, women are twice as likely to be affected by GAD as men. How common is GAD? So, generalized anxiety disorder actually बहुत common disorder है, and it affects about 3% of the adult population. If you have children between the ages of 13 to 18 years, so you will see that 1 in 4 children at some time have childhood anxiety. पर जो lifetime prevalence है of severe anxiety disorder, if we take children ages 13 to 18, then that is approximately 6%. What are the symptoms of generalized anxiety disorder? So main symptom GAD का is the excessive and persistent worry about everyday things. And ये जो persistent feeling है of anxiety or dread, that is what is interfering with how you live your life. तो जिन लोगों को GAD होता है दे हैव ट्रबल कंट्रोलिंग देयर वरीज या नर्वसनेस एंड उन्हें पता होता है कि दे वरी मोर देन दे शुड. तो सिम्टम्स ऑफ GAD जो होते हैं दे फ्लक्चुएट ओवर टाइम एंड दे आर वर्स अगर इंसान स्ट्रेस एक्सपीरियंस कर रहा है. सो हम पे सेवरल सिम्टम्स हैं दैट यू कैन सी ऑन योर स्क्रीन हियर. वी हैव रेस्टलेसनेस. द पर्सन विल फील वेरी ऑन द एज और इरिटेबल. दे विल बी वेरी इजीली थक जाएंगे, फटीग हो जाएगा, शॉर्टनेस ऑफ ब्रेथ या हार्ट पाउंड कर रहा है, हार्ट पैल्पिटेशंस, मसल्स टेंस्ड, मसल टेंशन. देन इधर वो जग नहीं पाएंगे, लाइक सो नहीं पाएंगे या फिर सोते नहीं रह पाएंगे, बार बार ऐसा कच्ची कच्ची नींद आती है एज वी से इन हिंदी. और headaches होंगे, muscle aches, stomach aches, unexplained pains. Actually, a lot of people, there's the study that a lot of people who end up going to the physician for physical symptoms actually have some sort of a mental stress or anxiety, and then other symptom is also difficulty concentrating. So it is important to note that obviously occasional anxiety or worry is part of a normal life, and many people may worry about things like health, financial issues, family problems. पर जिन लोगों को GAD होता है, they feel extremely worried या nervous more frequently about these and other things, even when there's like little or no reason to be concerned about them. Now we'll be discussing kind of the risk factors हैं or like some factors that increase the risk of developing generalized anxiety disorder. So we have personality. अगर we have a person whose temperament is very timid या बहुत negative इंसान है and they avoid anything dangerous, so they will be more prone to GAD than other people are. Then we have genetics, as we discussed, कि generalized anxiety disorder may run in families. And we have experiences that people with generalized anxiety disorder, they may have a history of significant life changes, बहुत trauma experience करा है, negative childhood experiences रहे हैं, या recently कोई traumatic या negative event experience करा है. Or maybe they have chronic mental illnesses, medical illnesses, या mental health disorders हैं that are putting them at risk. And lastly, even though it's not mentioned here, but we discussed earlier, that women are diagnosed with generalized anxiety disorder somewhat more often than men are, so that is also a risk factor. Okay, so what causes generalized anxiety disorder? तो researchers को exactly नहीं पता cause क्या है GAD का, but they think it's a complex combination कि genetic factors भी हैं, biological भी है, environmental भी है. And you are more likely to have GAD if you have a first degree biological relative, like एक sibling है, कोई parent है. And then there are also several areas of your brain and biological processes जो एक key role play करते हैं in fear and anxiety. But researchers are still learning more about these complex processes. Researchers have also found कि कुछ environmental factors हैं that put you at a higher risk for developing GAD, like trauma, stress, chronic illness, or negative childhood experience. Now we'll be discussing the DSM-5 criteria for generalized anxiety disorder. So criteria A is excessive anxiety or worry. This means कि जो person है, they experience excessive worry and anxiety for at least 6 months, and 6 months में जो majority period है, there they are experiencing that anxiety and worry. And जो ये worry है, that is about multiple events or activities like work, school, health, relationships, and this anxiety is difficult to control and it is not limited to specific situations. Criteria B is difficulty to control the worry, which means कि जो person है they're struggling to keep their worry in check even if उन्हें पता है कि it is excessive. Then we have criteria C, which is associated symptoms. So we need there are 6 symptoms given here, and you need at least 3 out of them to be true for adults, or at least one of them to be present for children. So first is restlessness or feeling on the edge, which means कि उन्हें बहुत nervous लग रहा है, they're not able to relax. Second is easily fatigued, which means कि उन्हें बहुत unusually tired लग रहा है because of this mental tension. Third is difficulty concentrating or mind going blank. This is basically कि उन्हें trouble हो रहा है focusing because of the worry. Then we have irritability कि उन्हें बहुत easily annoyed लग रहा है, upset लग रहा है. We have muscle tension, which basically includes physical symptoms like tightness, aches or soreness in muscles. And lastly, we have sleep disturbances. So either they are not able to fall asleep, stay asleep, या उन्हें बहुत restless लग रहा है, या फिर बहुत unsatisfying sleep आ रही है. Criteria D is significant distress या impairment. जो anxiety है that is causing clinically significant distress या फिर impairment अलग अलग areas of life में, social, occupational और other important areas में. Criteria E is not due to another medical condition या substance, which means कि जो symptoms आ रहे हैं they are not caused by a substance like drugs or medication or because of another medical condition like hyperthyroidism. Criteria F is that it is not better explained by another disorder, which means कि जो symptoms है they are not due to any other mental disorder like panic disorder, social anxiety disorder, OCD, PTSD. So basically, GAD में persistent, excessive and uncontrollable worry है, and they should be there for at least 6 months, and इसमें physical symptoms भी है, and the worry is not limited to specific situations or objects. Comorbidities of GAD. So GAD rarely exists alone, and it often coexists with other mental and physical health conditions, जिससे symptoms और worse हो जाते हैं and treatment is more challenging. Psychiatric comorbidities में many people with GAD also experience depression, panic disorder, substance use disorder. Depression most common रहता है. Substance use is also a concern because जिन लोगों को GAD होता है they might turn to alcohol या drugs to cope with their anxiety. Other mental health conditions like PTSD, OCD can also complicate treatment जिससे और ज़्यादा severe distress हो. Medical comorbidities में GAD affects the body as much as the mind, and people with GAD are at a higher risk for chronic pain conditions जैसे migraines या heart disease या digestive issues like IBS and acid reflux. Because the stress hormones होते हैं released because of the persistent anxiety can worsen these conditions, creating a cycle जहाँ पे poor health से anxiety बढ़ रही है और फिर anxiety से physical symptoms बढ़ रहे हैं. So impact basically क्या रहता है in comorbidities का on treatment is that comorbid conditions से GAD becomes harder to manage and इससे और severe symptoms आते हैं, longer recovery time हो जाता है. So treating both the anxiety and the coexisting condition is crucial, and इसलिए we need a holistic approach जिससे हम थेरेपी, मेडिकेशन, लाइफस्टाइल चेंजेस सब कुछ कंबाइन करें ताकि वी ब्रेक दिस साइकिल एंड इंप्रूव द ओवरऑल वेलबीइंग. मूविंग ऑन टू डिफरेंशियल डायग्नोसिस ऑफ GAD. So diagnosing GAD is challenging because उसके symptoms overlap करते हैं with many conditions, and I know this topic is kind of confusing for a lot of people. So I'll try कि मैं से बहुत simply बताऊं. So सबसे पहले differential में आ सकते हैं other anxiety disorders, like सबसे पहला panic disorder. तो what you have to remember is panic disorder में sudden intense panic attacks आ रहे हैं, whereas GAD में continuous state में इंसान है of worry. Then social anxiety disorder. So social anxiety में क्या याद रखना है कि जो fear है social anxiety disorder में वो situation specific है ना, सिर्फ linked है to social interactions, whereas GAD में generalized anxiety है again. Then OCD. OCD is characterized by intrusive thoughts and compulsions, पर GAD में सिर्फ excessive free floating worry है. PTSD. Anxiety जो PTSD में होती है that is tied to past trauma, but GAD की worries are they are more generalized. And phobias. So phobias में भी fear is linked to specific objects या situations, but GAD में broad और persistent anxiety है. Okay, moving on to mood disorders. Mood disorders में हम पे MDD और bipolar. So major depressive disorder दोनों में ही और GAD दोनों में ही negative thoughts आ रहे हैं, but MDD is dominated by persistent sadness and loss of interest, whereas GAD is revolving around excessive worry. And bipolar में क्या है, देखो bipolar में alternating periods होते हैं mania depression दोनों के, which is differentiating it from the constant anxiety of GAD. फिर मेडिकल कंडीशंस भी हैं. हाइपरथायरॉयडिज्म में भी रेस्टलेसनेस हो जाता है, रैपिड हार्ट रेट हो जाता है, दैट मिमिक्स एंजाइटी बट दैट इज बिकॉज ऑफ हार्मोनल इम्बैलेंस. फिर कार्डियोवैस्कुलर डिसऑर्डर्स अगर है किसी को, हार्ट पैल्पिटेशन, ब्रेथलेसनेस वहाँ भी होती है, एंड दे आल्सो फील लाइक एंजाइटी बट देन दे आर स्टेमिंग फ्रॉम हार्ट रिलेटेड इश्यूज. तो रेस्पिरेटरी डिसऑर्डर जैसे COPD, एजमा, वो भी दे कैन आल्सो क्रिएट सेंसेशंस ऑफ ब्रेथलेसनेस सिमिलर टू एंजाइटी अटैक्स. एंड न्यूरोलॉजिकल डिसऑर्डर्स अगर है, पार्किंसन, एपिलेप्सी, can also present like anxiety, but they are because of brain dysfunction. फिर सब्सटेंस रिलेटेड डिसऑर्डर्स, सो सब्सटेंस इंड्यूस एंजाइटी होती है, वहां पे जो एंजाइटी है दैट इज ट्रिगर्ड बाय ड्रग यूज या विड्रॉल, अनलाइक क्रॉनिक वरी ऑफ जीएडी. एंड मेडिकेशन साइड इफेक्ट्स, अगर को तुम स्टिमुलेंट्स ले रहे हो, कॉर्टिकोस्टेरॉइड्स ले रहे हो, दे आल्सो कॉज रेस्टलेसनेस एंड एंजाइटी लाइक सिम्टम्स, बट देन अगेन दैट इज अ मेडिकेशन साइड इफेक्ट. एंड पर्सनैलिटी डिसऑर्डर्स लाइक अवॉइडेंट एंड डिपेंडेंट. तो अवॉइडेंट में क्या है कि उन्हें फियर ऑफ रिजेक्शन एंड सोशल इनहिबिशन है, दोज आर सेंट्रल, बट जीएडी में अगेन जनरलाइज्ड है. And dependent personality में भी एक excessive reliance on others for decision making, whereas GAD is focusing on multiple worry domains. So in conclusion, accurate diagnosis is essential because different conditions require different treatments. And although GAD में persistent generalized anxiety है, but इसलिए it should be carefully distinguished from other disorders to ensure the right approach to treatment. Moving on to a very important topic, management and treatment. So management and treatment of GAD के लिए we have psychotherapy also and medication also. So let's start with discussing psychotherapy or talk therapy. So psychotherapy में क्या करते हैं? We help individuals identify and change those unhealthy emotions, thoughts and behaviors. So we have trained licensed mental health professionals like psychologists and psychiatrists जो ये थेरेपी प्रोवाइड करते हैं, एंड इट नॉट ओनली प्रोवाइड्स इमोशनल सपोर्ट बट ऑल्सो एजुकेशन एंड गाइडेंस कि तुम कैसे अपनी डेली फंक्शनिंग ओवरऑल वेलबींग improve कर सकते हो. So we have different psychotherapy approaches, but CBT or cognitive behavioral therapy is the most commonly used treatment for GAD. CBT में हम फोकस करते हैं ऑन रिकॉग्नाइजिंग एक्सेसिव वरिंग या फिर जो भी नेगेटिव थॉट पैटर्न्स हैं जो इस बिहेवियर को इन्फ्लुएंस कर रहे हैं, एंड देन वी हैव स्ट्रक्चर्ड सेशंस जिसमें हम इंसान को सिखाते हैं दैट यू चैलेंज दोस इरेशनल फियर्स एंड यू अनलर्न ऑल दोस अनहेल्दी थिंकिंग बिहेवियर्स एंड रिप्लेस देम विद हेल्थियर कोपिंग स्ट्रेटजीज. एंड ओवर टाइम इस प्रोसेस से इंसान की एंग्जाइटी कम होती है एंड वी हैव अ मोर बैलेंस्ड माइंडसेट. We also have medications जिसमें we have antidepressants and anti-anxiety. Antidepressants में we have SSRIs and SNRIs. SSRI stand for selective serotonin reuptake inhibitors and SNRI stand for serotonin norepinephrine reuptake inhibitors. And they're commonly used to treat depression, but they're also effective in managing GAD symptoms. इन medications को several weeks लगते हैं to show noticeable effects and work because ये regulate करते हैं neurotransmitter levels to improve mood and reduce anxiety. इसके अलावा वी हैव एंटी एंग्जाइटी मेडिकेशन. सो बेंजोडायाजेपिन इज वन जिससे एक रैपिड रिलीफ मिलता है फॉर सिवियर एंग्जाइटी, बट इट कैन लीड टू टॉलरेंस एंड डिपेंडेंस, सो इसलिए हम इन्हें बहुत शॉर्ट टर्म यूज के लिए प्रिस्क्राइब करते हैं. एंड वी हैव बिस्पिरोन विच इज अनदर एंटी एंग्जाइटी मेडिकेशन जिससे 3-4 हफ्ते लगते हैं टू बिकम फुली इफेक्टिव, and this is a non-sedative alternative for long-term anxiety management. But medication is not effective alone and you need therapy and lifestyle changes ताकि एक comprehensive approach हो to treating GAD. Coming towards the end of today's presentation, we have prognosis of GAD. So GAD एक chronic condition है, but with proper treatment, symptoms can be effectively managed. जो course है of GAD that varies, कुछ लोगों को बहुत mild manageable symptoms आते हैं, whereas कुछ को बहुत severe long term anxiety रहती है. जितनी जल्दी intervention होगा, obviously उतने अच्छे outcomes आएंगे. You have CBT, you have medications that significantly reduce symptoms over time. Comorbidities हैं like depression or substance abuse that can make recovery more challenging, but they are manageable अगर एक comprehensive treatment plan हो. And you also need lifestyle modifications, exercise, stress management, support systems because they all play a crucial role in maintaining long-term stability. So in conclusion, GAD is more than just excessive worry and it affects a person's daily life, relationships, overall well-being. Early diagnosis and personalized treatment plans are key to improving quality of life. We have reached the end of our video. Thanks for watching. I hope I was able to give you a clear explanation of generalized anxiety disorder. If you have any questions or doubts, feel free to drop them in the comments below. Don't forget to like, share and subscribe for more psychology content. See you next time. Bye.